Welcome, everyone. I'm Greer Bailey from eHealth Learning.
Hi, and I'm John Wilks, also from eHealth Learning. Nice to be here. Nice to see you, Greer.
Nice to see you with our free course offering this month on the vagus nerve. We thought we would come in and have a discussion and just kind of talk about some of the fascinating things happening in our practices and in our life related to the vagus. So to start
Yeah.
us off, I'm curious, John, what about the vagus nerve has been showing up in your practice, or what have you noticed in some of the courses and studies that you've taught and done?
Yeah. No, thanks, Greer. I mean, I've been fascinated with the Vegas. I think it was since I heard Stephen Porges talk. I used to organize these conferences in London called the Breath of Life conferences. And I can't remember which year it was. It was at least 15 years ago when he first came over to the UK, and he gave his presentation on the Vegas, and it was completely blew me away in his whole thing about the polyvagal theory. I thought at that time he should have received, or he should receive a Nobel Prize for his work, because it has such massive implications, for society, for relationships, for the clinic, clinical work and stuff like that. So I've been kind of fascinated ever since then. And in terms of how that, what that shows up in the clinic, I've also got very interested in various approaches, because there's lots of ways of working with the vagus that people have developed, through the breath, through touch, through social interaction, and we've had a lot on eHealth over the years, which, if you join up, you can see a lot of courses and webinars with people like Deb Dana, who's worked with Stephen Porges for many years. I've done a whole series on it. We've had various other people talk about it, Michael Cheyenne, amongst others. But so what I've got really interested in is that you can come at this from a lot of different angles, I think. And as manual therapists, we've got a kind of unique thing that we can do in terms of like actually touching, or very, not directly touching a vagus, because that wouldn't be possible, but you can get pretty close to it. And, I think we tend to focus in a lot of the polyvagal work on things like the breath, things like social interaction, things like the effect of trauma and stuff on the vagus, which is all, incredibly important, and perhaps less so on the physical things that can affect the vagus. So, classic kind of nerve entrapment, things like how viruses can affect the vagus. We see this a lot. I think we've seen it a lot in things like long COVID, and then also bacteria, things that you see that in Lyme's disease. So I think clients can show up with a lot of different kind of symptoms that affect the vagus for many, many reasons, and maybe a multitude of reasons, which might be structural and might be related to their trauma history, or history, other medical history, viruses and stuff. I mean, one of the places that we tend to work a lot with craniosacral work is the neck, around occiput and the atlas, because the vagus goes really, really close to C1 and particularly C2. And so it's interesting how you can get, even things like digestive issues or IBS related to issues with the neck. And I think particularly from my work with babies, like particularly because you see this playing out a lot with babies, particularly where they've had some injury to the neck. So like classically with adults, it tends to be more related to whiplash injuries. And when babies, you see it a lot in relation to how they've been born, like with forceps or suction or something like that, which involves quite a lot of traction around the area. So it's a very big subject, and very interesting to get to the bottom of what's going on with people with this, I think.
Yeah, I don't hear a lot. I think I'm hearing more about it, but I don't hear a lot about like those like structural and like with the viruses and the bacteria and like what's affecting the nerves and the nervous system. So I really like that there's more and more attention being brought there.
Yeah,
Uh,
yeah. I think since COVID, and because the whole thing with long, so many people seem to be suffering from this long COVID thing, that I think there's been more research. In fact, one of the areas that they seem to be focusing on is the vagus. How does long COVID affect the vagus? And I think because the vagus is such a long pair of nerves, and well, it's called vagus because I think it comes from the word vagrant, doesn't it, originally? Like it wanders all over the place.
Yeah.
And it's very long. It's got lots of little ganglion, and it connects up with so many different nerves, like other cranial nerves and blah, blah, blah. And then it's got this long pathway all the way through the body. So I think in terms of perhaps where viruses might affect nerves, like, a virus can affect things in shingles, that's a similar kind of a thing, where it's a particular part of that nerve, not the vagus in this case, but so I think depending on where the nerve might be compromised will very much depend on the person's symptoms, whether maybe it affects their breathing or their heart or their gut, or you know what I mean? So I think it's complicated. I think it's complicated.
I was revisiting Jill Miller's most recent book on breath. And I came across, she has some really great sightings of the research going on. And I really liked, it was in the Brain Research Journal. But when they were electrically stimulating the vagus nerve, it was tied into helping with verbal memory, which I thought was really interesting. And I think they're starting to do studies around with Alzheimer's patients, but it was also really effective with trauma and treatment-resistant depression and epilepsy. I thought that was really fascinating. And I think I get too really fascinated about that supraclavicular social interaction, the vibration, working not just with the breath, but working with singing or humming or tapping, and bringing in those aspects, I think, can be really fascinating.
Yeah, no, it's great. And I think it's really great that it gives people so many tools to work with this directly, doesn't it? It's quite empowering if they can, I often encourage my clients to sing, or, in the shower and stuff. Or
I thought you meant in the treatment.
No, in the treatment, no.
And one, and two.
That'd be a good idea.
That would be fun.
I might be a bit self-conscious, but anyway. So and you mentioned about the breath, Greer, because that's such a powerful tool, isn't it, for people to approach. And that book you mentioned, she also talks about how, I can't remember, isn't it how you have your pelvis slightly raised or something? To help stimulate. I thought that was really interesting. Can you describe that? Because I didn't pick that up quite so clearly.
Well, from what I can recollect, so rising the pelvis up. So if you have a soft block on a table and raising the pelvis up, there's something about that stimulates and calms the nervous system. So I can imagine it's very similar to that, that relationship with the rest and digest. But I don't remember the specifics of the why, the raising of the pelvis. So you've got me. I'm okay, where's my book?
No. I think it was something around the baroreceptors or something, isn't it? It's something I'm not really familiar with, but there's something about increased pressure, which then stimulates the vagus. So anyway, I mean, there's lots of ways, isn't there? With some of the Wim Hof stuff and exposure to cold water swimming and all this kind of thing, which is really coming to the fore, isn't it? Now with people with depression and all kinds of stuff like that. So it's such an interesting and wide-reaching topic. And what we've covered on the eHealth, just to go through, I did a whole series which if you join up as a member on eHealth, you can get access to that. And what we're doing on eHealth over the next few months is we're opening up our library of courses to people. So we're offering one course a month from our library. And this month, we've got a series with Michael Shea, who approaches, he calls it the multivagal approach. And so he looks at it also from a manual therapy point of view, and particularly a craniosacral point of view, and goes through kind of various handholds that you can use for really making contact with the vagus, particularly where the vagus is more kind of superficial in the body. So like around behind the ears, around the neck, particularly around this area here, and around the diaphragm. So it's really, really good. And then if you look at the previous webinars, because that's all available to members as well, there's a series of 4 that I've done, which also includes some material from Stephen Porges's lectures that he gave in London. So that's some of that footage is there as well. And also we've done quite a few interviews with Deb Dana, who's written some books with Stephen Porges on clinical applications of the polyvagal theory. And we've done other stuff as well with other presenters around this too.
Yeah.
So there's a lot to see.
I'd love to hear from the eHealth audience too, just because there's such a collection of gems. Like, what's some interesting aspects that you found in your practice working with the vagus? Either sharing in the comments or posting on Facebook. I would really love to hear and share all that we know. So please comment.
Yeah, great. Thanks, Greer.
No, thanks, John.
Please do join us for this. Just join up at ehealthlearning.tv and see what we've got to offer. And next month we'll be doing another topic, but this month is the vagus. Thanks, Greer.
Thanks, John.
Take care. Bye.